Oh, Mr. Ajit, good morning.
Good morning.
How are you today?
Pretty good, and yourself?
Nice you were able to come over here.
Thank you for inviting me in.
And I understand that you wanted to take a tour of the house and what a foster home looks like. And I'll be more than glad to show you around.
All right, sure. I had a few questions regarding the foster home.
Sure.
And seeing more about the facility.
Okay, well, let me tell you first of all, as you can see, it's a regular house. We have living areas like just like any other house, maybe your home, anybody else. And the only difference we have here is this is fitted for elderly people to live in this home and conduct their activities on a daily basis with all the help they require. Now, in the tour that I'm going to give you, I'm going to show you around. We're going to look at the rooms, we're going to look at the bathrooms, and all the equipment that we have in place to help them the best we can. Now, I understand that you're looking into placing somebody in your family and you wanted to take a look at a foster home before making a decision.
Yes, that's what I was exactly what I was thinking.
And you are familiar with the larger facilities, which is like nursing homes and retirement communities.
Yeah, I wanted to see the different options and stuff.
Right.
I wanted somewhere where she would honestly be cared for, on a personal level. Yeah.
Very wise on your part, because you should look at the resources you have available before deciding where you want to put your loved one. Okay. Mm-hmm. Now, one of the differences we have is in smaller facilities like this, there is more one-to-one care. You don't have the pressure of having too many people to take care of. Here at the most we have 4 people that we care for. We have 2 attendants that are always available. And it's a very small facility, so that everything that needs to be done for them is done very in a very orderly manner, so that they have a very even day with all the activities that they need to conduct. Now, one of the things that I wanted to point out, let's go and have a sit over here. Let's sit down. Okay, Mr. Ajit, let me go ahead and give you my brochure. This is informational brochure about our services, and feel free to ask any questions if you have something in mind.
Well, I'm glad that she's gonna have some personal care. That's exactly what I was looking for. However, I wanted to know what kind of activities she'd be doing. I mean, would she be active?
Well, we are prepared to meet those needs whenever a resident is coming. The first thing we do is to know what they like to do, because that's basic. If they don't want to do something, we're not going to force anything to them. Once we find out what they like to do, we work accordingly to make sure that we give them something that's going to keep them busy during the day and something they like to do. If they all like to do is sit down and read the paper, well, we prepare everything for them. But there is some encouragement to giving to them to do some other activities like manual activities or mental exercises to keep them updated on everything they need to know during the daytime.
Okay, that's good. Another question that kind of ties in, I want to make sure that she's not just confined to her room. Will she be free to walk around the house?
Of course, this is their home. All I'm showing you here is what they'll be able to use. The areas, living areas, the rooms, the backyard and everything is prepared so they can walk around at their will. There is no restrictions that are applied for anybody that lives here, because this is their home. That's the one thing that we go from based on the fact that you want to place your loved one in a place where she won't feel any different than if she was at home. And that's why we don't keep them in their rooms all the time. This is not an institution like a nursing home or a hospital. None of that.
Okay, that's good. That's what I wanted something like that. I wanted to know, she also has a specific diet. Would that be tended to if I give you a list of exactly what she needs and what she doesn't?
Well, the first thing I want to mention to you is that we've been doing this for many years. We are trained professionals. I'm a nurse myself. My wife is also a nurse. And everybody that helps us are CNA trained individuals that know how to meet a person's needs in terms of diet. Now, the other concern you may have is what happens when your loved one needs to follow up on their health conditions. Of course, that's something that there is always in mind of people. And there is options that we can offer to you in regards to that. Of course, they can continue seeing their own primary care physicians, or you can contract with someone that comes to the house to follow that. There is home health agencies, there are physical therapists and everybody that gets involved in their care that will come to the home to deliver those services. So as far as that, everything is covered. And of course taking into account the conditions. So hopefully that's
yeah, because I mean, my grandma, she needs therapies, and I just wanted to make sure that here they were qualified for that.
Yes,
to take care of that. All right, that's really good.
Exactly the type of service that you will be
providing. My grandma, I just wanted to ask you this also. She has a little puppy that she's really fond of, and she takes it everywhere she goes. I want to know, would she be able to bring it here?
Of course, that's something that we're prepared for, and they're welcome to bring their pets if they want to. We have a space for them in the backyard, and also they're welcome to keep them in their rooms if they want to. That shouldn't be a problem. The only thing will be for the residents subject to that, but I'm pretty sure that everybody will fall in love with puppies.
Okay, yeah, that's understood. That's understood. Y por lo último, mi abuelita no más habla en español. Nomás quería saber si así le pudieran comunicar.
Nosotros somos 100% bilingües en esta casa, tanto mi esposa como yo. Nuestras hijas ayudan también en el cuidado cuando están aquí. Ellas estudian, pero cuando están aquí también ayudan, y todos hablamos español. Nuestros asistentes son bilingües, pueden comunicarse con las personas que viven aquí que son español. No hay diferencia.
That's good to know. I guess that's all the questions I have for now, but would it be okay to take a quick tour?
Of course.
All right.
If you're ready, let's go ahead and do it. Okay, Mr. Julius, you can see this home is equipped just like any other home. You have all the furnishings that you will see at your home. We have a living area for our residents to enjoy that allows them to come over and sit down. If they want to watch a movie, we have a large screen TV here in the living area where they can sit and relax. We have also provided them with a dining table here because sometimes they find it a little bit difficult to go all the way to the dining area, so this will shorten the steps they have to take. And this is the bathroom. This is actually meant for the families when they come to visit. We occasionally use it for residents if they can use it, because we have the other one. But mainly it's just kept like this, so whenever someone comes and wants to have a little privacy, we provide them with this bathroom.
Ready?
This is the first one I'm going to show you. This one has 2 electrical beds. They are hospital beds. These are very appropriate for people that have a need for them. That's something that we have found that they need at times. They're equipped with all the safety equipment they need, like the sirens and all that. And they're both equipped the same. This is what you call a share room. Has 2 beds in it. That's a choice that we offer. Okay, this room is what a regular room looks like for someone that is, in this case, the person is paralyzed. We have all the equipment that they need. What you see on top of the table is called a trapeze that's used to assist the person moving in on the bed. Then you can see we have a Hoyer lift, and this is used to get people out of beds and transfer them to wheelchairs or to that chair that we have there to make things a lot easier for everybody so nobody gets hurt. Here we have a private room that was set privately for a person that prefers to be in her room watching TV. As you can see, she has everything that she needs close to her bed, and that way she can enjoy her stay here without a problem. And finally, this is our shower room. As you can see, this is equipped with a shower chair that can be rolled to the patient's room and bring them over here. You can see the grab bars on the side so they can hold on to while they're taking the showers. The shower room is equipped also as a bathroom in case they just need to come to the bathroom, and they have the grab bars on the side of the toilet so they can grab onto it whenever they're using it. And basically it's designed thinking about their daily needs. Well, that was a tour of our home, and I hope you found it informative and all the answers to your questions were answered. And of course, we're looking forward to serve you. You're welcome to come back and bring your parents to shake the house also, and your grandparents.
I appreciate your time. I appreciate you answering my questions, and I definitely appreciate the tour. Thank you.
You're welcome. Thanks for coming.